afterwards. But
Okay.
I want to welcome everybody. Thank you so much for joining us. It's really a great pleasure to hold the joint event with Conceivabilities. They have helped many of our intended parents throughout their journeys, and it's always a pleasure. They're very professional, responsive, and extremely helpful. And we've always enjoyed working with them. So hopefully we'll be able to provide you with some helpful information for your journey. A little bit about American Fertility Services. We're located in Greenwich, Connecticut. We have a very strong focus on third-party reproduction. About half of our patients are intended parents who've decided to build their families through egg donation and gestational surrogacy. And about half of those patients are international patients. We really take pride in staying in close communication with all of the patients, intended parents, and the agency, as well as the egg donor and surrogates. And this is how we've earned our trust by the agencies throughout the US and around the world. Our location, as we mentioned, is in Connecticut, which is actually very close to New York. We're about a 30-minute drive from New York City and about 45 minutes away from a major airport, JFK, located in New York. I'm going to advance the slides.
Should be able to do it.
Can you?
There.
I am on my screen. I am so sorry. I'm seeing a very large slide. Is that?
Okay, where are you?
Okay. We're on the next slide.
You should still have
Great.
control. Do you have control of the mouse, Dr. Wong?
Perfect. Thank you so much.
Okay.
Yes, I do believe so.
Okay.
Great. We do know that pursuing a surrogacy egg donation journey in the US is a very expensive process compared to other available countries. But there are some advantages that pursuing a journey in the US provides. As you know, egg donation and surrogacy are legal in the US, and therefore we're able to have open communication and no one is coerced in this process, and we're able to provide a legal framework that helps to spell out everyone's responsibilities and to protect everyone's individual rights. In the screening process, we not only focus on the physical and the medical aspect, we also strongly focus on the emotional and the psychological aspect of the patient's care. In terms of the embryology services, in the US, most of us use blastocyst cultures in addition to using PGS testing. And this technology allows us to greatly improve the precision in the embryo selection process. And it also helps us increase the chance of pregnancy for the intended parents without increasing the risk of multiple gestation for the gestational carriers. And in terms of safety standards, the American Society of Reproductive Medicine establishes up-to-date guidelines to ensure the safety of the gestational carrier as well as the egg donors. And so this is a very important aspect of pursuing the journey in the US. Selecting an egg donor, I think, is one of the most important steps to begin your journey. To the best that you can, you want to make sure that you're able to generate as many good quality embryos as reasonably possible. And these are some of the basic egg donor requirements that we recommend. Because aging affects all the cells in our bodies, including the ovaries and the eggs, we generally recommend working with egg donors between the ages of 21 to 31. And that's mostly because as we age, the number of eggs that we have, as well as the quality of the eggs, may decline. So this has been determined to be the optimal age. Body mass index is obviously important. Higher body weight may have a negative impact on egg quality. And certainly egg donors shouldn't have any unhealthy habits that may affect the chance of giving us a successful outcome. And we also routinely conduct psychological evaluations to make sure that the egg donors have proper motivation and that they don't have any psychological conditions that may prohibit them from egg donation. In terms of ovarian reserve testing, genetic screening, and infectious disease screening, we'll take a little bit more time and look at these in further detail. For women who are 21 to 31, there's still quite a big range in the number of eggs that they have, and this is what we generally refer to as egg reserve or ovarian reserve. In order to assess this, we use two very helpful tools. One is called antral follicle count, which we do through an ultrasound, and the second one is through a blood test called AMH. On the right here, you'll see an oval structure, which is a sonogram image of the ovary, and you may see these little dark spots, and each one of these is a follicle that contains an egg. And through ultrasound, we're able to count the number of follicles, which will give us a sense of how the donor will respond to stimulation, as well as how many eggs we can potentially retrieve. And each one of these follicles will release a hormone called AMH. And so by looking at the blood level, we're also able to correlate this. The higher the number of follicles we have, the higher the AMH. And as we approach running out of eggs, then AMH will approach 0. And so these two indicators are very helpful in assessing the donor's egg reserve. Obviously, young, donors, even if they have, even though if they're young, but if their ovarian reserve is low, they're probably not optimal donors. In addition to just making sure that we have a good number of eggs to work with, we also want to make sure that the donor and the intended father are not carrying any genetic mutations in common, which would obviously compromise the health of the baby. So it is important for us to review the family history for the donor, as well as perform blood tests that allows us to screen anywhere from 200 to 300 different genetic conditions. And about 25% of the tested individuals will be a carrier for at least one condition. So it is very important for both the donor and then the intended fathers to be screened so that we can cross-check the results and make sure that they do not share a common mutation. As you can imagine, any type of tissue donation is a potential risk factor for transmitting an infectious disease. And because of this, the U.S. Federal Drug and Food and Drug Administration, or the FDA, they set very strict standards and guidelines that we have to follow. First and foremost, for any facility that is involved in tissue donation, they must first register with the FDA. And this way, the FDA can perform scheduled but unannounced site visits. So this is an important part of the quality control. We have to conduct very thorough medical, social, and sexual history for the egg donor. We have to administer an infectious disease questionnaire, as well as perform a thorough physical exam. The FDA requires us to do a very detailed infectious disease testing panel within 30 days of the egg retrieval. And not only that, these tests must be performed by FDA-approved laboratories. So not any laboratory can perform these tests. So as you can see, these are very strict guidelines that we have to follow to ensure that no infectious diseases are transmitted in the process of egg donation or embryo or sperm donation. We'll switch gears a little bit and talk about the screening requirements for gestational surrogates. This process is also very important. Usually, you've worked very hard and spent a lot of time and effort to find, the donor that fits your needs and your expectations. And we want to also make sure that these embryos have the optimal conditions to result in healthy, viable pregnancies. Age is also important. However, because gestational surrogates are not contributing the eggs, therefore the age requirement is a little broader, from 21 up to about 43. As long as the surrogates have had healthy full-term pregnancies in the past, no prior pregnancy complications or repeated miscarriages, I think we can consider a broader range of age groups. Body mass index is also important. Obesity is associated with higher risk of having miscarriages as well as other pregnancy complications. So a healthy BMI is one of the important criteria. Obviously, the gestational carrier should not smoke or have any other unhealthy habits either. We perform, or the agency helps us obtain a very thorough psychological evaluation for the surrogate as well as her partner, making sure that they have a safe and supportive environment. On the clinic side, we also perform infectious disease screening as well as detailed uterine evaluation. We typically do what's called a saline sonogram to make sure that the uterus doesn't have any polyps, fibroids, or any gynecologic conditions that may interfere with the implantation process. As far as how the screening procedure works, generally speaking, the agency are extremely helpful in obtaining the prenatal and the delivery records from the gestational carriers, and they allow the doctors to review these records. And also, if the surrogate is an experienced surrogate, we will also request for prior treatment records for us to review as well. The agency will also help the surrogate arrange evaluation by an obstetrician and to obtain medical clearance by the obstetrician. As we mentioned before, we would also recommend a psychologist or a licensed social worker to perform a very detailed, thorough psychological and home, and social evaluation. If a surrogate passes through these initial steps of screening, then we would invite them to our clinic for an in-person interview. There, we discuss further about the risks and obtain their consent to proceed. We also perform infectious disease testing for the surrogate and her partner, as well as drug screen and nicotine screening. And as we mentioned before, we also perform the detailed ultrasound to make sure that there are no other gynecological issues that we need to address. And at this stage, once the surrogate passes all of these screening steps, most of the time we will enter a legal phase where the intended parents and the surrogate discuss and come up with a contract. And once the contract is signed and executed, then we can plan for the actual embryo transfer. And the embryo transfer process is actually relatively simple. So gestational surrogates will begin a 2 to 3 week estrogen regimen, and that will help to thicken up the endometrial lining inside the uterus. After that, we would perform a sonogram to make sure the lining thickness is adequate. And then following that, the next step would be addition of progesterone, which is another medication to help prepare the endometrium to receive the embryo for implantation. And for this final embryo transfer, the surrogate will travel to our clinic for the procedure. About 10 to 12 days after the embryo transfer, we would check the pregnancy test and hopefully give you a positive outcome, positive report. In terms of how to prepare for your journey, there's more than one way to approach this, but I think one fairly common path to consider is to first come to a clinic in the US and for the intended father to do a sperm freezing appointment. And on that day, we would do a semen analysis, freeze the sperm sample, do the FDA infectious disease testing, as well as perform the genetic testing that we mentioned before. Generally, this appointment should take about half a day. So it's a relatively straightforward and short visit. After that, the intended parents can return home, and then they can work with either the clinic or the egg donation agencies to find a suitable egg donor. And then we would help and have the egg donor come to our facility for the egg retrieval. We would thaw the sperm, fertilize the eggs, create the embryos, and then freeze the embryos. Then after that, the intended parents would work with the surrogacy agencies to find a suitable gestational carrier And once we go through the screening process and the legal contracts are signed, then we'll proceed with the final embryo transfer to the gestational carrier. In preparation for the intended father to come to the U.S., we think that it really will be a good idea to do a baseline semen analysis and infectious disease testing back home. This way, it will allow us to identify any potential issue that may need to be optimized or addressed or treated prior to flying all the way over, to the U.S. For the sperm freezing appointment. Although we can send the genetic testing kits to most international destinations, often this can be a little bit difficult to arrange. So I think for the most part, it may be easier just to wait until you visit the U.S. clinic to perform the genetic testing. And just like egg donation that we mentioned, intended fathers are considered as technically sperm donors relative to the gestational surrogate. And so the same FDA guidelines have to be followed when we freeze the sperm sample. And again, this is what we refer to as the donor eligibility determination. We have to perform infectious disease testing, a physical exam. We have to administer a risk factor questionnaire, but it all has to be done within 7 days of providing the sperm sample. Obviously, the COVID-19 pandemic is affecting the whole world, and it has, for the most part, made it difficult for our international intended parents to begin their journey because of the travel restrictions. And so, I want to share with you a little bit of our recent experience. We have had some intended parents who have requested whether they can freeze their sperm samples remotely in an international clinic, and then arrange to have the sample shipped to the United States. And some of the difficulties we have encountered is that the FDA requires the international clinic to be registered with the US FDA if they want to export donated tissue. Most clinics we found have not registered with the FDA, so this may be one potential barrier. And as we mentioned, the donor eligibility determination also must be performed by the clinic locally, and many clinics are not familiar or are not comfortable with this process. And also, as we mentioned, donor testing must be performed by an FDA-approved laboratory. So this would involve shipping the infectious disease kits back to the United States laboratory. So as you can imagine, there are a lot of logistical steps that would need to be arranged. And the other issue that we have encountered is that the intended use of the frozen sperm must also follow local regulations. So there are some countries where surrogacy is not allowed. The clinics have reached out to us and asked us to provide a written statement stating that the frozen sperm that's being shipped to the U.S. is not intended for surrogacy, which obviously is very difficult for us to do. If the intent is to create embryos for the use of surrogacy. The cost of hand carry transportation of frozen sperm and embryos is a common practice prior to COVID-19. It's quite expensive. My understanding is it usually ranges in a $4,000 to $5,000 range. But because of COVID-19 and travel restrictions, it has made it even harder for professional couriers to complete these transports. Often they're required to be quarantined for 14 days in one country and then quarantine another 14 days when they arrive to the U.S. And in my recent discussion with a couple of the couriers, they have temporarily stopped this service. So some of the transportation barriers are at the moment difficult to overcome. And I think for the most part, hopefully, someone will come up with a vaccine, and hopefully in a few months, the global situation will improve and international travel will resume. At this stage, I'll turn over to Gina Marie for the second part of the presentation.
I'd like to take a moment to introduce Gina Marie Maddow, who is the Director of Legal Services at Conceivabilities, and she'll be presenting the legal portion of this presentation.
Thank you, Lori. I'm excited to be here with everyone tonight to discuss the legal aspects of surrogacy and egg donation. In addition to my agency experience as the Director of Legal Services, I'm also an attorney as well as an experienced egg donor. So bringing some personal as well as professional experience to the group. Now, the agency's role in gestational surrogacy and egg donation is a very complicated process to navigate for both domestic and international intended parents. There are many components of your journey that really do require an agency's expert assistance. Hiring a competent and experienced agency will provide intended parents, carriers, and egg donors with the peace of mind that their journey will receive the time and attention needed to seamlessly carry them through all steps of the process. Agency professionals at Conceivabilities are well versed in all aspects of surrogacy and egg donation, which includes the medical standards, surrogacy laws, with many of the staff having personal involvement in the process, as well as advanced clinical and professional degrees. Now, your agency is going to recruit gestational carriers and egg donors. They're going to coordinate with your fertility clinic. They're going to match you with an appropriate egg donor as well as carrier. They're going to assist with the screening process of the carrier and donor, assist with travel arrangements. They're going to manage your match and your pregnancy. When you're thinking about your agency and its importance, it's important to work with an agency that has experience with proven success records. Longevity within the industry is also a plus. Your agency should provide a partnership approach with you to the journey. They should go through this process for you hand in hand, helping you every step of the way. Next slide.
Sorry about that.
And the legal role in gestational surrogacy and egg donation. At Conceivabilities, that starts with the matching process. And our process is called Matching Matters. Now, for the match process, there is a large legal component to that. It's important that you are matched with a carrier in a state where your parental rights can be established. The applicable state law tends to be where the gestational carrier lives and where she will deliver the child. Each state has its own laws. So what we're doing during the Matching Matters process is researching the various state laws and consulting with attorneys in those states to be absolutely certain that any match we present to you is in a state where your names can be placed on the child's birth certificate. We're also providing you with legal education, legal support, and legal oversight of the entire journey. So that means from the date that you sign up with Conceivabilities, every step of the way and all the way until you have your baby in your arms with a birth certificate that establishes your parentage, we're with you every step of the way. Now, once you're matched with the gestational carrier, you're going to need a contract. And this would be the same thing if you're matched with an egg donor as well. It's always important that you have a contract directly with your carrier as well as directly with your egg donor. There should be separate independent representation for these contracts. That means that you, the intended parents, will need your own attorney, and the gestational carrier and egg donor will also need their own attorneys. It is important that these attorneys specialize in reproductive law. There are some really important complexities and nuances to surrogacy and egg donation that make it important to have an assisted reproductive technology attorney. Just any old attorney won't do. It should be one who specializes in reproductive law. And those attorneys are going to help with the drafting and the negotiation of the terms. You know, it's common for there to be some back and forth negotiation with the contract, but that's a good thing. It shows that both parties had adequate representation and that everyone understands the contract terms. Another step in the legal process is all intended parents should have wills in place. And your wills, or your last testament document, should be completed prior to moving forward with any cycle schedule or any transfer. And your will should provide a guardian and alternate guardians for any children that are born through the process. It's also important that you identify a designated guardian or caregiver in case you are unable, if there are travel restrictions and you're unable to actually get there for the birth. It's important that you have some support and someone that's able to assist you in that way if travel restrictions make it so that you're unable to be here. Now, establishing your parentage. The exact way that we establish your parentage depends on many different factors. It depends on the state where your gestational carrier lives and where she will deliver the child. But it also depends on the state, or the country where you live. Each country has its own laws about surrogacy, and what you want to do is consult with an attorney in your home country about the citizenship and immigration process in your home country. Because what we're going to be doing for you in the United States is we're going to be obtaining a birth certificate with your names. And it's important that your home country attorney is consulted in this process so that we make sure you're matched in a state where the birth certificate is going to look exactly the way that you need it to look, so it doesn't impact the immigration or citizenship process once you're back home. Now, keep in mind that your child will be born in the United States, and that means that he or she will automatically obtain U.S. citizenship, which is the great thing. But you also may be looking for citizenship in your home country. We're advising you from a U.S. perspective. So it is always important that you have an attorney in your home country to assist you from your home country's perspective. Now, we can help you get a U.S. passport for the child. That process has become a little bit more challenging under the new COVID restrictions, and it's a bit more time consuming. Prior to COVID, we would have said, maybe you'd be home in like 2 to 4 weeks or so, but now the expectation is that it's taking a bit longer. There are emergency travel documents that in some cases we're able to draft for you to help speed along the process, but it's also important that you understand that there could be a bit of an extended time for you to be in the United States, and you should be prepared for that as well. And that's also a reason to have that designated caregiver to be able to offer you support while you're here as well. Those are the legal steps that you're going to go over for the surrogacy and egg donation process: finding an appropriate match, having a contract with your carrier and donor, designating a guardian or caregiver, working on your estate planning documents and your wills, establishing your parentage, and then traveling home and getting a passport for the child. Thank you for listening to the legal and agency role in gestational surrogacy and egg donation. I'm going to turn it back over to Lori now for our question and answer period, and we hope to hear from a lot of you so that we can partner with you on this journey. Thank you.
Thank you, Gina Marie and Dr. Wong. We've gotten some questions. The first one is for Dr. Wong. If we don't provide the sperm, what are the donation options? Do you work with a sperm bank?
Yes. There are several reputable sperm banks throughout the U.S., and we can certainly assist with anonymous sperm donation.
Fantastic. Thank you. Next question is for Gina Marie regarding the agency home visits. Are they part of the surrogate screening for international surrogacy?
So at Conceivabilities, we don't do in-person home visits. We conduct a screening process that's done via video chat, and then the carrier also has a screening that's completed at the fertility center, like at American Fertility. But there isn't an in-person home visit, but we do encourage you to visit the carrier at her home if you do have that flexibility.
Great, thank you very much. And the next question is a segue from that regarding the contact with the surrogate. How much contact will there be? Is that a personal decision?
Sure. So at Conceivabilities, we are a relationship-based agency. So it's very important to us that you develop and build a strong relationship with your carrier. But what that looks like for all intended parents and carriers is a little bit different. So part of our Matching Matters process is a directed match meeting. So that means that your first conversation with the carrier will be a video chat where both intended parents will be there. The carrier and her partner or spouse will be there, and then there will be a match expert leading the call, just to make sure that you're touching on all of the important topics to be certain if it's an appropriate match for you. Once you're matched, our requirement is that there's a minimum of weekly contact. And typically we prefer that contact to be via video. So, you can have like a standing Tuesdays, 8 p.m. video call with your carrier. And there's no time frame for that. How long or how short those conversations will be depends on what's going on, in your journey. And you also have to take into account but sometimes life gets in the way. So maybe one week you aren't able to do a video call, but you exchange an email or you're texting. That's okay too, as long as there is consistent communication between the parties. The times when we see the most successful journeys are those that are built on trust and strong communication between the intended parents and the carrier. A lot of times intended parents have questions or concerns about what is my carrier doing? How do I know that she is following all of the guidelines and holding up her end of the bargain? And to that, I say to intended parents, just talk to her. Ask her all of the questions that you're asking your agency, how can I make sure she's doing this? You can just say to her, I'm nervous about this. I have a concern. I have a fear about this. I know that it might sound silly because you're trying so hard for us, but this is a concern. And see how she responds to you. Her response should reassure you that she is in this with you to partner with you throughout the process. If you choose to not communicate with your carrier, that can lead to a total communication breakdown. It is to your benefit to stay in touch with her, obviously, within healthy boundaries and something that makes everyone feel comfortable, not terribly overbearing, but you want to be open and honest at all times.
Excellent, thank you very much. The next one's a two-part question, really addressed to both of you regarding the screening of the surrogate. I think Dr. Wong mentioned the psychological screening, but what are some of the criteria, and then who gives the final clearance to move forward? Is it a medical clearance?
I could start with it, Lori.
Yeah.
So from the agency perspective, we're going through what's called our gestational carrier acceptance process. And that's a process where the carrier is filling out our initial application and being educated by our staff members, many of whom are experienced surrogates, about the process. And then we're going to do an initial screening of the carrier from the agency perspective. Part of that also includes collecting all of the obstetrical records, reviewing all of those, and then presenting that total package to your fertility center, to Dr. Wong's team, to say, here's this carrier, she has passed our screening process, here are her medical records, and now you pick it up from here. Then they take over and they review the records and go through their screening process. But the doctor, your doctor, Dr. Wong, will make the ultimate determination as to whether she can proceed.
And just to add a little bit to that, and this is absolutely correct. And I find that the record review is truly a very important part of the screening process, because aside from really going through all the past records page by page, really all the information is pretty much voluntary, provided by the gestational carrier. And I do think that, for the most part, people are very honest, very forthright. But from time to time, sometimes you may find issues from past pregnancies that might not have been mentioned in the profile. It doesn't necessarily preclude someone from being a gestational carrier, but these are issues that we may need further clarification. And so our job from that perspective is to do the due diligence and really review. Often we have hundreds and hundreds of pages of records to review, but we take our time to do so. And as Gina Marie said, ultimately we will work with the agency, communicate any sort of further clarifications that we need, and we would do the final screening, physical exam, infectious disease screening, ultrasound, and perform the final clearance from a medical perspective.
Okay, fantastic. Thanks so much. Next question is regarding some restrictions with travel. What countries may be restricted? That's part one. And part two is, in the states, what states are more surrogate friendly? Should they look for surrogates in certain states?
So in terms of the surrogacy friendly states, there are many states in the United States that are surrogacy friendly. The states that you really want to avoid are Michigan, Nebraska, and Louisiana. In all of the other states, you're able to complete at least some form of gestational surrogacy. But without knowing the specifics of your case, it's really hard to answer what state is a good option for you, because it depends on whether you are a heterosexual couple, if you're using your own embryos, donor egg, or sperm, if there's any genetic relationship, and it also depends on your state or country of residence as well. So the broader answer is there are many states besides Michigan, Nebraska, and Louisiana that will work, but this is where you want an expert agency to help you go through the specifics for your case to really pinpoint these are the better states for your situation.
Okay, great. And Dr. Wong, did you mention some countries that there were some restrictions?
Sure. So far, it's unfortunately the majority. We've had difficulties for Asian countries, Taiwan, China, Singapore. Most of the intended fathers are really on standby, waiting to come when the travel restrictions are lifted. Europe, the UK, Spain. We have encountered a lot of barriers there as well at the moment.
Okay, fantastic. We'll just hope for the best that those are lifted shortly.
Yes.
And I know everyone's excited about getting started, so they'll be in queue and ready and waiting to go. So I think that concludes the questions. If there's any last minute questions, please submit them now. However, I appreciate your time and dedication, and this webinar has been recorded so that we will be able to share it out to those who were unable to attend this evening. Doesn't appear anyone's typing, so thank you to Dr. Wong and Gina Marie and everyone who's made this webinar a success, especially the audience participation. And you all have a great night. Thank you so much.
Thank
Bye-bye.
you.
Thank you.
Welcome.